Why younger people are getting colon cancer screenings earlier. Health alert. Imagine discovering a silent threat lurking within your body, one that could have been caught early, but often isn't until it's too late. This is the grim reality many younger individuals have faced with colorectal cancer. But here's where it gets hopeful. Thanks to increased awareness and expanded screening efforts, people in their 40s are now catching this disease earlier than ever before. Over the past few decades, doctors' offices have seen a rise in younger patients under 50 reporting symptoms like blood in their stool, persistent abdominal pain, or unexplained weight loss. All red flags for colorectal cancer. And this is the part most people miss. While these symptoms were often. Why younger adults are getting colon cancer earlier. Screening, symptoms, prevention tips. Colorectal cancer is striking younger adults, and fast. While some welcome the increase in early detection, the real story is far more complicated than many realize. Are we just finding more cases thanks to expanded screening? Or is something else silently fueling this concerning rise? The answer isn't as clear-cut as it might seem. Here's the scoop. Recent research is revealing more colorectal cancer diagnoses among adults under 50, especially since more young people are getting screened. And this is the part most people miss. The overall spike in cases started long before the screening guidelines changed. In 2018, the American Cancer Society adjusted their advice, urging average-risk adults to begin screenings at age 45 instead of 50. By 2021, the U.S. Preventive Services Task Force followed suit, matching the lowered screening age. Did those changes work? Partly. The shift has undeniably led to more early-stage cancers being caught in people aged 45-49. Take this. The percentage of U.S. adults in that age group considered up-to-date with screenings jumped from about 20% in 2019 to over 33% in 2023. That's real progress. But, and here's where it gets controversial, experts say this step alone doesn't explain why the overall number of colorectal cancer cases, especially advanced ones, has been climbing in young adults since the mid-1990s. What's behind the rise? That question is stirring heated debate. Researchers are exploring everything from changing diets and processed foods to microplastics, environmental influences, and even shifts in gut bacteria, all introduced over the last few decades. According to Elizabeth Schaefer, a scientist at the American Cancer Society, there's currently no single smoking gun. Dr. Joseph Rinaldi, a gastroenterologist, echoes this, pointing out that many likely factors, environmental, genetic, or lifestyle-based, are still being unraveled. For now, the jury is very much out. But there's no denying screening helps. The most rapid jump in early-stage diagnoses has happened since young adults began screening earlier. For perspective, early-stage colorectal cancer diagnoses among 45 to 49-year-olds nearly doubled, from 9.4 per 100,000 people in 2019 to 17.5 in 2022, a 50% surge in just 1 year. That's huge. Yet Schaefer points out that if screening were the only factor, we'd be seeing more early-stage cancers only, not the parallel increase in advanced disease. And here's something many overlook. Most people younger than 45 still aren't eligible for screening, and even among those who are, many haven't been tested. Jessica Starr, another American Cancer Society researcher, stresses the importance of knowing the warning signs, regardless of your age or screening status. Did you know that more than half of those diagnosed with colorectal cancer before 50 aren't even old enough to have started screening? What should you watch for? The top symptom is rectal bleeding, experienced by around 41% of patients under 50, compared to 26% in older patients. Other signs include ongoing changes in bowel habits, unusual stool shape, appetite loss, abdominal pain, and unexplained weight loss. If these symptoms last more than a few weeks, it's crucial to tell your doctor, and if your concerns are dismissed, seek another opinion. Far too many young people have had their symptoms mistaken for benign issues like hemorrhoids, only to receive a cancer diagnosis much later. Take Kelly Spill's story, for instance. After childbirth, she started experiencing alarming symptoms, which her doctors initially attributed to postpartum changes and internal hemorrhoids. It took persistent self-advocacy, including photographing her symptoms and insisting on a colonoscopy, for her to be diagnosed with stage 3 rectal cancer at only 28. Today, thanks to targeted immunotherapy, she is cancer-free, but her experience is a powerful reminder that pushing for answers can be life-saving. Of course, screening remains a powerful tool. It works by finding and removing precancerous polyps before they evolve into cancer. Options include annual or triannual stool tests, colonoscopy every 10 years, virtual colonoscopy, and sigmoidoscopy every 5 years, all effective for spotting issues early. But here's a contentious point. Recent studies suggest that simply mailing screening kits directly, instead of waiting for people to request them, dramatically boosts screening rates. Should programs go further and make screening even more automatic? Despite improvements, over a third of adults 45 and over still aren't getting screened as recommended. This problem is even bigger among those without regular healthcare access. So, how do we close that gap? More outreach, more education, or perhaps new policies? But let's not stop there. Prevention goes beyond screening. There's good evidence, highlighted by the American Cancer Society, that lifestyle choices, like avoiding tobacco, limiting alcohol, eating less red and processed meat, staying active, and maintaining a healthy weight, play a major role. In fact, over half of colorectal cancers in the U.S. are linked to these preventable risks. Dr. Rinaldi recommends focusing on a plant-based, fiber-rich diet and steering clear of sugary drinks and refined grains, a point that can spark its own debate among nutritionists. So where do you stand? Is the recent upswing in colorectal cancer simply a result of finding more cases sooner, or is something in our environment driving a true increase? Should universal screening start even earlier, or would that cause more harm than good? Share your thoughts below, especially if you have personal experiences or strong opinions. The conversation about cancer prevention and detection is complex, and your perspective matters.